First of all, my thanks to Dr. G. Vijayakumar and thanks for the chairpersons. My topic is going to be on pancreatic exocrine insufficient diabetes. The pancreas has both endocrine, that is blood glucose regulation, and exocrine digestion functions. And pancreatic exocrine insufficiency is because it is very commonly seen, but of late we miss this diagnosis very often. And it is more common in people with diabetes than realized and can significantly impact the glycemic control. And you can see the pancreas produces digestive enzymes, proteases, lipases and amylases secreted into the gut, and PEI occurs when enzyme production is insufficient, that is to digest food adequately, causing maldigestion, malnourishment and nutrient deficiencies, especially fat soluble vitamin ADEK, vitamin ADEK. And what causes pancreatic insufficiency? Tissue destruction of the pancreas, nerve damage, inadequate stimulation of the enzyme producing tissues, and balanced pancreatic duct, impaired enzyme delivery because of the pancreatic duct obstruction, and autoimmune or infection, damage to the exocrine and endocrine functions. And what is the connection between the pancreatic exocrine insufficient and diabetes? Why it is common in diabetes? Because postmortem study shows pancreatic structural damage in people with diabetes, fibrosis, shrinkage and fatty infiltration into the pancreas. 9% of the people with diabetes have pancreatic disease as the cause, often misclassified as type 2 diabetes. And insulin deficiency may cause loss of pancreatic tissue, and diabetic neuropathy may impair the enzyme secretion. Microvascular damage may reduce the blood flow, causing fibrosis and atrophy. And how common is this in diabetes? 50% abnormal pancreatic function in type 1 and type 2 diabetic patients, 51% in type 1 diabetics, and 32% in type 2, 80% in chronic pancreatitis. So, and these figures are based on fecal elastase levels, not on the symptoms. Here the patients have been directed with the fecal elastase levels, and then they have been classified like this. And the signs and symptoms you can see: loose bowel movements, abnormal pale yellow stools, abdominal discomfort, flatulence and bloating. You would have seen in, almost in most of the diabetic patients will be having these complaints, common complaints. And fatigueness, erratic blood glucose control in severe and untreated pancreatic and exocrine insufficiency, and weight loss in severe cases. It's very, very common. And this is Bristol stool chart. It will be like this, you know. You can see separate hard lumps like nuts, hard to pass, that is type 1. In type 2, sausage shaped but lumpy. In type 3, it is like sausage but with the cracks on its surface. And fourth type is like a sausage or snake, smooth and soft. And in type 5, soft blobs with clear cut edges, passed easily in the stool. And sixth type is of fluffy pieces with ragged edges and mushy stool. And seventh last type is watery, no solid pieces, entirely liquid. This will be the different form of stools, which is called as Bristol stool chart. And diagnosing is exclude other causes first. That's very important. Medication, side effects like metformin, GLP agonist, we know gastroparesis, celiac disease, and irritable bowel syndrome, and bowel or gastroenteritis. And the only test which is easy is fecal elastase 1 test. A single spot stool specimen measures elastase 1, a pancreatic enzyme that passes unchanged through the gut. So it is easy way to detect, and further investigation may include CT scan or endoscopy in the severe cases. And if the stool elastase is between 100 to 200, it is mild pancreatic exocrine insufficiency. If it is less than 100, it is severe pancreatic exocrine insufficiency. And the treatment is pancreatic enzyme replacement therapy, that is called PERT, and usually we start with 25,000 units with the snacks and adjust until the symptoms resolve. That is the treatment. And taking PERT is swallow the capsule whole with food, avoid hot drinks at meal times, keep at room temperature, and if unable to swallow, you can mix that powder in the yogurt or something, you can give the patient on the food also. And dietary support, dietitian's referral is essential. Fat soluble vitamin supplement is also essential, and PERT is derived from pork pancreas. That's very important. So in vegetarians, be careful. So managing the pancreatic and exocrine insufficient diabetes together, impact on glycemic control. PERT can improve HbA1c up to 11 millimoles, that is 1%, reduces the episodes of mild to moderate hypoglycemia, stabilizes the blood glucose through consistent digestion, may increase insulin production in type 2 diabetes. Weight gain may affect insulin sensitivity and requirements. So PERT is not needed when treating hypoglycemic with glucose or non-diet drinks. Only if a follow-up on starch snack is required. So you should be very careful with using PERT in this condition. Thank you.